So I'm here today with Tracy Mountford. How long have I known you for, Tracy?
Oh, too long, Adrian. About 20 years.
Probably about 20 years.
Yeah.
And Tracy was one of the pioneers in the aesthetics industry. And we're just going to be talking a little bit about your experience, where you've come, just really want to pick your brains about, what's important in the industry. Yeah. So tell me a little bit, Tracy. So what's your background? How did you start?
Well, I started off in anaesthetics, actually. I was in hospital medicine, and then it was very many years ago. It was 1990, around that time. So I've been in the industry about 30 years, just touching on 30-ish years. But I got an interest in the industry because things were beginning to happen abroad, mainly in the United States, where non-surgical work was just really beginning in the days of collagen.
Yeah,
injections. We remember collagen injections and skin peeling, and I just developed a genuine interest in it. Yeah. And decided to just take a sort of mini sabbatical and learn more, and the rest is history. Yeah. I never went back to anaesthesia.
So you were anaesthetic, and then you really were one of the first adopters, weren't you?
Yep, there was hardly any of us.
Who was there in those days?
Rita Rakers,
yeah.
Patrick Bowler,
yeah.
Then there was then followed swiftly on by John Curran,
yes.
and Mike Cummins, yes. Actually. So and they set up, the British Association of Cosmetic Doctors, yes. In those days. But there were about 7 of us in the room. I mean, there was hardly anybody there.
Yeah, that was the whole.
That was the beginning, yeah. And it was before everybody was thinking just more of surgery. I mean, we were all just aware of all the surgical things that could be offered, which still are. Yep. But non-surgery was very much in its infancy, yeah. Very new.
And what was offered in those days? What treatments did you have?
Well, not many. I mean, we had a very limited palette. Again, as I said, injectables in terms of fillers, it was collagen, yeah. Which was good. I mean, yeah. Collagen was all we had, so we made it work. Yes. And of course, with that product, I mean, we were basically just filling lines. Yeah. So rather than now, and we'll possibly talk about this later, where we've adapted and moved on to more sophisticated treatments, we just used to fill lines and wrinkles with collagen. We would not have anything else to relax muscles at that time. Bit of skin peeling, yep. Bit of lasering. Yes. And that was pretty much it. Yes. And topicals, but not many.
And the collagens obviously come from animals or humans, and you have to have a skin test, don't you?
Yeah, that was a negative. Yeah. So though I loved it, yeah. But there was quite a significant allergy risk. Yes. So you do a little skin test under the arm, do the consultation, and then wait 28 days. And if that skin test was negative, you could go ahead with the treatment. Yeah. But the problem with that was really that, and we all know this as practitioners, yeah. That people would often, not lose their interest in the procedure, yeah. But sort of, you wouldn't see them again, they'd go off trying to explore something else. So yeah. It was a problem, that skin test, that took so long yes. to come to fruition. And even if the skin test was negative, very occasionally you'd have adverse events, so you would see yeah. the odd allergy still yeah. then.
And the toxin you were using those days, can you remember that far back?
Yes, I mean, we weren't using much. When I first started off, I wasn't using any toxin.
So it's just purely fillers?
Purely fillers, yeah. Peels, lasers. Yeah. Because 30 years ago, I mean, when did toxin really hit the market? I mean, its FDA was way behind when we were using it.
Yes, so it came in after the fillers,
yeah.
didn't it? Yeah,
yeah,
absolutely.
So I was trained on toxin a good few years later.
Yeah.
And that's when I started to introduce it into practice yeah. then, but I'm talking a good few years later.
Good few, yeah.
Yeah.
And then filler-wise, we sort of moved from the collagens, didn't we, to the hyaluronic acids. Talk me through yeah. that experience.
Yeah, it was an interesting one, because collagen was the one thing about collagen was that you could put it into often a lip yeah. area. I remember the Paris lip.
And then what was the Paris lip? Tell me about the Paris lip.
It was the big lip, and the yeah. lip that we well, personally I don't particularly like now, but it was very much the Bardot lip, and yes. the Bardot lip only looks really good on Brigitte Bardot.
People might
yes.
not know.
Yeah, sadly I do, and you do. Yeah. Do, yeah. So the Brigitte Bardot lip, that very yeah. really beautiful lip, but that lip only looks good on
Brigitte Bardot.
Yes.
Yeah.
So collagen was good because there was minimal swelling. There was yes. hardly any swelling. You could put it in a face and put a little bit of, ideally not makeup, but something to, and it would look great on an evening out.
So it wasn't hydrophilic like
it wasn't hydrophilic.
No.
But the advent of hyaluronic acid fillers was good because we don't have to skin test.
Yes.
It makes it much quicker for a patient if they want to engage with treatment sooner than the 28 days they could.
Yeah.
We started to get more adaptable and more exciting with what we were doing with our hyaluronic acid treatments, and it's hydrophilic, which works to our favour, but it can work, as you know, sometimes to our detriment.
Yeah.
So the lovely hydrophilic properties of hyaluronic acids is that we get that lovely smoothness, that lovely lift, but the negative is sometimes it causes short-term swelling, as we know.
Absolutely. And which hyaluronics were you starting with initially?
Okay, so you want me to name names, do you?
You can, yeah.
Okay, so we were using more Restylane.
Yes.
And Hyalorform. Do you remember Hyalorform?
Yes. It's a name from the past, isn't it?
Hyalorform and Hydrophil. We were using those kind of products in the early days.
Yeah.
And they were good. I mean, there was nothing to, really worry about. They were good products.
They worked well, didn't they?
They worked well.
Yeah.
They were, and for us as clinicians, we want safety is everything to us. First, safety.
Yeah.
Second is result.
Yes.
First, do no harm. They would give great results, but they, over the years, as you know, the companies would bring in more products, but also more versatility. So the areas that we were using them, there were different strength products and different cross-linking and different G primes and all the things we know.
Yeah.
And then gradually Juvederm, of course.
Yes.
So Juvederm is another HA, and there's goodness knows how many more HA fillers. I mean, how many are there? There's numerous fillers.
Hundreds in the UK. I mean, tell us a little bit about fillers in the UK compared to America, because in America they're FDA.
Yeah.
And then we're moving on.
Yeah. I mean, obviously, from a safety point of view, I tend to always will go with an FDA cleared product, and I think patients will be well-informed patients. I think should be looking for an FDA cleared product, which means it's gone through, as you and I know, it's gone through all the safety checks, it's gone through all the hoops, it's been tested thoroughly. I think in Europe and the UK we can offer far more fillers, because in the States nobody can use fillers that aren't FDA cleared. Cleared. And in the UK and Europe, frankly, it is.
Really. Yeah.
And that can be a big negative, as we know. So I will only generally stick, obviously, to FDA cleared, because I believe then you can reassure a patient hugely. But it does restrict use a bit, because, as we know, some of the Juvederm products get later FDA clearance in the US, and we can actually, we've got our clearance here far sooner. So that's quite interesting when we speak to our American colleagues and that actually we're using products they can't use.
So that's a great thing about here. So probably would your advice be use a product from a major manufacturer?
Always.
Yeah.
Yes.
How would you caution people about possibly using lesser known fillers?
I think, look, I always say I'm not here to be the cosmetic police. I'm here to just give an opinion. I think for my patients or anybody out there thinking about injectables, it should be the golden rules are, for a clinician, we should be looking at reputable companies, people that will give us backup, backup and support if something happens, but even backup and support just generally to help us develop our practices, to help us grow a successful practice. So I would always go with reputable companies, fillers that are FDA cleared, and those companies will provide good training. I mean, you, Adrian, do your training courses, but that is key, is that you get trained appropriately, professionally, and you have ongoing training so that you keep up to date and you're not going to make terrible mistakes. And the quality
of the product is obviously paramount. So you said a little bit about that safety is the main thing for you, Tracy.
Oh, yeah, absolutely.
Yep.
It's a big thing, and it's a topical thing at the moment.
Yep.
I mean, I think that nobody should ever embark on a cosmetic procedure of any kind unless they are equipped to deal with the side effects, adverse events, or even serious complications to that treatment.
So hold on there, Tracy. So we're going to be talking in the next video about side effects and complications.
Yeah.
Thank you very much.
Thank you.